Sean, this decade of delay we're hearing is damaging, but is it down to a misunderstanding? Quite often, adults look at young people, teenagers, and think, oh, it's just growing pains, it's adolescence, it's normal, when in fact it isn't.
That is one factor where parents, schools, teachers at schools, and the adolescent themselves don't understand that the symptoms that they're having is part of a mental health disorder. They just don't understand that. But the second issue is that even if they do and they want to be referred on, some young adolescents and some parents don't want to refer on for whatever reason, and quite often there's a stigma attached to it. Although we're doing a lot better with stigma in this country for mental health issues, for children it's a bit more pronounced. And then there is the most important aspect, which is when they do want to be referred and get access, they can't because it's a fragmented, people describe it as a maze when you want to go in to get some access to services. They don't know where to go, and it's a long waiting lists, and they don't get the treatment quick enough. And in this case, what we have come up with is 10 years, which is shocking.
Ranj, we heard from Nikki there in Kathy's report, someone you also know, and she talked about the importance of finding this situation and dealing with it early, because if not, does it snowball over those 10 years while they're waiting for help?
Well, that's the thing. We know that, as you saw in the report, over 50% of mental health problems in adults start in childhood, but less than 50% of those people are able to get the appropriate care that they need. We know that as these things don't get dealt with early, they grow, they potentially get worse, and the cost to the individual and to society grows as well. What we really need is early intervention and early support. As Sean quite rightly pointed out, this is a very complex area. There's not one thing that's going to be the answer, but what we do need to get right is getting people access to the right therapies at the right time. And also, we need to get our act together when it comes to prevention. We need to start equipping young people and children with the skills to help themselves as well.
So, Sean, though, you've got to be equipping the likes of parents, carers and teachers to notice the signs then.
Yes, there has to be, there is, in some parts of the country, there's quite a good awareness programme for parents and young people to understand what's going on and then do something about it. But that's very patchy. In normal circumstances, that's not the case. Mental health awareness should be really quite widespread.
And just briefly, Ranj, we've mentioned there the Duke and Duchess of Cambridge, Prince Harry as well, have made young people's mental health one of their key causes. They want to remove this stigma that Sean was talking about there. How important is it for people like that to join in on this?
It's massively important. Awareness is the first step that we need to address, and we are addressing it well. The problem is, what are we doing after we're raising that awareness? When people come forward and say, I need help, are we then able to meet those needs? And that's where we are falling down time and time again, particularly when it comes to the most vulnerable in society, and that's children and young people's mental health. We need to put in strategies and systems where we can start helping them with the right care from an early age. And that includes, is not restricted to, putting mental health, at least awareness or well-being into schools.